Good afternoon, it's 6 minutes past 12 midday. The Mannin line in session through till 1 today. And your Health and Social Care Minister, David Ashford, is with us live. If you'd like to get in touch, you can text on 166 177, email studio@manxradio.com or call 66 13 68. 76 days with no confirmed cases. The total number of tests, 8,480. 12 people are awaiting results of a test, and nobody's waiting for a test at the moment. So the number of confirmed cases remains at 336. And David Ashford, good afternoon, welcome.
Good afternoon, Andy.
Good to talk to you. Well, we are in the midst of a 76-day lull, and yet the disease continues to rage elsewhere. What state of preparedness are we in for a second wave?
So certainly within health and social care, we've been working very much to ensure that if we did need to reverse decisions and restore capacity, COVID capacity at Nobles, we are in a position to do so. We've also still got the testing teams that, although they've returned to ordinary duties, can be redeployed back if necessary.
It's raging in some places. 857 people died in Mexico yesterday. There are places around the world. And Spanish flu, you reminded me, had 4 waves. Is that right?
Yes, it was 4 waves in total of the Spanish flu that basically ran from about 1918 to 1920. The second wave was actually the most deadly of the Spanish flu. The third and fourth were actually quite low level, but it did go on for a period of about 2 years in total.
How prepared should the population of the Isle of Man be for another wave?
Well, let's be blunt. We are going to see more cases. I've said that all along, but just from the virtue of people travelling and coming back. But the only cases we should see with our current policy are people who are already in isolation, because people are required to isolate upon return. So that's the type of case we shouldn't worry about. The cases we should worry about is if we started to see community transmission again, because that would obviously be a very serious moment.
Just remind us, how does track and trace work?
So the way track and trace works is we haven't gone down the route of other countries of trying to do it electronically and sending texts. We actually physically contact people. So public health will interview the person who has COVID-19, find out where they've been over the last few days, who they've been in contact with for over 15 minutes and less than 2 meters apart. They will then contact those people and instruct them to self-isolate.
So if somebody who's been asked then, what happens if they can't remember? I mean, what sort of process do public health go? Where have you been? Who did you, if you went into the co-op or you went into the spa, how long were you there, that sort of thing?
Well, it's close contacts thereafter. So
Right.
Again, it's the emphasis on the 15 minutes, being with someone 15 minutes less than 2 metres apart.
Right.
So someone walking through the co-op, you wouldn't be expected, obviously, for them to know everyone they've had interaction with. But with COVID-19, the risk is for people who are 15 minutes and to do less than 2 metres apart. So those are the close contacts that then would be contacted to self-isolate.
Okay, let's go to the lines. I think we've got Charlie with us, first of all. Charlie, you're with the Health and Social Care Minister.
Good morning. Congratulations to the government for keeping COVID out of the island to start with.
Oh, thank you, Charlie.
Your health and social care, what does social care cover?
So social care covers the community side of care. So we've got things within social care such as mental health. You've got children and families services. You've got the provision of nursing care, the regulation that goes with that in terms of registration and inspections. So it's basically the opposite side of health. So it's anything to do with community health services.
Well, I was supposed to go away to Broad Green in April. And I cancelled it with because it was the day before you shut everything down. Now, on the 30th, I had to go away again. It was imperative, the surgeon said. I tried to arrange, I'm my wife's carer, I tried to arrange some help for my wife. And I think the 6 departments of government I got in touch with, there's nothing in the Isle of Man to cover emergency care for an individual who needs assistance.
Right, we do provide respite care, but I know there has been an issue with turning the respite services on because we actually have had the staff redeployed elsewhere during the COVID period. So being quite frank, it has taken longer than I would have liked for us to turn back on the respite services. So that might have been the issue. If you want to email me with your situation, then I'm happy to look into it and see what we can do to try and resolve your individual problems.
Okay, Charlie, if you want to get in touch, if there's anything else you want to mention.
I did get in touch on the 24th of June. I'm still waiting for a reply from.
Well, now the minister knows about it. If you want to get in touch with...
He knows about it because my MHK has been in touch with him as well.
Who's your MHK?
I haven't...
Kane.
I haven't spoke. I don't remember that particular one being raised with me, Charlie. I'll be honest.
Okay, well, Charlie,
but
now
if you contact me directly, I'm more than happy to look into it.
Okay, Charlie, now we've got that on the record. So if you want to get in touch with Mr. Ashford, then we wait for that. Department of Health and Social Care is what? GPs and dental, community healthcare, hospital healthcare, mental healthcare, social services for adults and children with families, and specialist off-island care. And talking of services, resuming services, while the department's been dealing with coronavirus, which I'm guessing it's taken most of everybody's time, we've got a message in from Jackie who said, I'd be interested to hear the Health Minister's thoughts on the current waiting times for joint replacement surgery. My husband's in constant pain. Has been quoted a 2-year timescale for a hip replacement. On inquiring whether he'd have the operation privately on the island, he's been told that it's not available at the moment. In the current COVID climate, going off island is not an option, and ideally he'd prefer to have surgery here. What initiatives does Mr. Ashford foresee to reduce the waiting time, and when does he anticipate private patient surgery can recommence?
Well, again, being very blunt, orthopaedic waiting times are far too long. They were far too long pre-COVID as well, so this isn't something that's just happened via COVID. So the department is looking at various waiting list initiatives that we may be able to do to try and speed it up, because when people have issues like that, particularly chronic pain is normally caused by them. 2 years, I fully appreciate, is far too long to wait. And of course, the situation isn't going to get better. It can only ever get worse. So I have been having conversations with the department to see, particularly in the orthopaedics area, what we can do to try and bring the list down. We are constrained in some ways because, of course, the UK is seeing their own lists back up and they are going to prioritise any of their own work over assisting us. But I think there is various things we can do. In terms of the private patients unit, that was due to open, being run by a third party in June this year. But again, it got affected, obviously, during COVID, and we needed to use it for our COVID response. So our timescale now is to have it open for January.
Charles is with us now. Hello, Charles.
Hello there. Good afternoon. Good afternoon, Minister.
Afternoon, Charles.
Yeah, I'd like to ask you a question about physio. My doctor referred me to the Westmoreland Road physio department, but every time I go there, either in person or by telephone in the first thing in the morning, I get told everything is gone and there's no room for me. And also that they won't even take my particulars down when I go in.
Right, I don't know why they won't take your particulars, Charles, because they should still obviously be taking particulars off people who need it. Again, physio is one of those that unfortunately did get massively backlogged during COVID because it is quite literally hands-on. And during the COVID period, all but the essential physio was completely suspended. So I know they have got a backlog, but again, with your individual case, if you contact me, I'm more than happy to personally look into it.
Yeah, because I've got in this letter it says if I don't get contact with them or take my particulars down by the 14th of this month, I'll be deemed to be not wanting the service.
Right. Well, like I say, I don't see why they haven't taken your particulars, and I'd like to look into that. So if you're happy to get in touch with me personally,
how do I do that?
So you can email. My email address is out there publicly.
I don't have your
well, my telephone number's public as well. It's 427-232.
Okay, thank you very much.
427-232. You must be very frustrated personally, and I guess within the department, that lots of things have been put on hold, inevitably and by necessity. But is it a matter of money, or is it a matter of getting qualified staff and the consultants and people in place to get that backlog cleared?
It's actually a mixture of the lot, really, Andy. I mean, money is always going to be an issue because it's not a never-ending pot, and we have to recognise that. I think I've said before when we've done one of these shows, I could probably take the whole Isle of Man government budget and spend it on health, but that's not obviously practical. So we do have to work within financial constraints, but equally, in a lot of specialist areas, there is huge demand for those specialisms. So there's real competition for staff, and that's not just within the UK. That's actually worldwide. So we have been quite lucky in the fact we have been able to recruit over here to some hard to recruit to posts in the last 12 months, but staffing is still a constant issue.
Where are we in the queue? Are we at the back of the queue, the middle? Where are we for getting treatment in the UK?
In terms of getting treatment in the UK, we partner very well with the hospitals in the northwest. We have arrangements in place. We are quite lucky, actually, by our geography that we have access to some brilliant health centres in the UK. They've always worked with us on an equal basis. I've not seen any evidence that they're not continuing to do that, even with the COVID period. But we do have to accept that obviously they're under strain as well with their issues. And I don't think it's a case of being at the back of the queue, but it's being in the same queue.
Roger is with us now. Hello, Roger. You're with David Ashford.
Good afternoon. Good afternoon, Minister.
Hi, Roger.
And, like the other caller, I'd like to thank you and your colleagues for the good work that you've done and doing and keeping us safe. But I do have a question, and my concern is, I'm sure that yourself and your ministers are talking every morning and monitoring the situation across. For example, just recently, Manchester has been declared a crisis with their numbers, Rochdale, Bradford, Leicester, Wales, etc. And then, of course, into Europe with Italy, France, Spain, Greece. And what my concern is, our residents that are returning from some of these countries, when they come back, as I understand, they have to self-isolate. But with the surge in numbers across, the risk is higher. And, for example, if they can get a taxi from the airport to their home address to isolate, if you, I, or any one of our community was then to get into that taxi, the risk is higher maybe than what it was when the Chief Minister declared we were going to level 4 with the borders. Have you or are you considering that we may return to stage 5 purely on a statistic and a risk value?
At the moment, no, and the reason being that although the UK is seeing daily spikes, so they're seeing, for instance, a couple of days where they're in the 900s, but then they're seeing days where in the 400s and 500s of cases being identified as well. So if you take the 7-day rolling average of the UK, it's more plateaued than actually gone up. They are seeing spikes, as you rightly say, in certain areas, particularly Greater Manchester, which they're having to lock down and deal with individually. But in terms of the overall case number of the UK at the moment, it is still pretty well plateaued. Their infection rate isn't dramatically declining. Obviously, we've said all along that all of our decisions are fluid. In terms of taxis, I should point out that taxis actually have a cleaning regime in place, which the drivers should be going through after each passenger. So taxis have been always classified as actually fairly low in terms of transmission risk, and the taxis continued to operate throughout the entire COVID-19 period as a result.
Okay, thank you, Minister. As always, you put my mind at rest, and hopefully there's a lot of other people listening or will feel the same way. Thank you very much.
Thank
Stay
you.
safe.
Thanks, Roger. And here's Scott with us now. Hello, Scott.
Hi, good afternoon.
You're with David Ashford.
Hi, Scott.
Hi, Mr. Ashcroft. What it is, I have sent you an email recently regarding this sort of query. We're soon to go across to Alderhay Children's Hospital with my son. And when we return to the island, we're aware we have to self-isolate for 14 days. What it is, there's myself and another colleague, actually. We both work for the Isle of Man Steam Packet, and every week during the COVID period, we've come into contact with people from the UK who have been on board working and have been given an exemption certificate by the Manx government to come over to the island and work. And that exemption allows them to travel between a place of accommodation on the island and the vessel. When we return to the island after being in the hospital, we have tried to get the same exemption that the government gives to UK employees to allow us to travel between work and our home on the Isle of Man, but this keeps getting denied. And at the end of the day, we're going to have to take time off work unpaid. I just wondered what your thoughts on this are.
Yeah, I mean, obviously we have spoken about this via email. In relation to it, as the law currently stands, the exemption in relation to work can only be granted for work purposes. Because you're travelling for a purpose that isn't work, the Cabinet Office's hands are tied in being able to grant an exemption, is my understanding, because it's not travel for work purposes that you'll be going for, it's for health purposes. Obviously, the people who have to isolate with patient transfer is the patient themselves and anyone accompanying them. So I know in your circumstances you've got to go over yourself. Unfortunately, as it stands, though, it will be 14 days. But I think, as you may be aware, the Chief Minister announced last week that depending on how things are going in the UK, we may consider at the end of this month moving to a 7-day and test process. So that's still not absolutely ideal for you, but unfortunately that is the situation with the law as it stands.
Would you have to take the time off as holiday, Scott? Why would it be unpaid?
Well, because my son's health conditions means I'll be back and forth to and from Alderhay a few times.
Oh, right.
Eventually running out of my annual leave, so I would have to take unpaid leave.
Yeah, I mean, I think it is something maybe that that we would have to look at for key workers in terms of the law. And I know, since I referred your query in, Cabinet Office has been looking at that. But as the law currently stands, it's only if it's been travel for work purposes. And unfortunately, obviously, travel with your son classes as health travel, not as work travel.
All right, Scott, thanks for bringing that up today. We've taken note of that, and let's see where that goes in the future. It's 22 minutes past 12 midday. The man in line today is with your Health and Social Care Minister, David Ashford, MHK.
Listen to us on your smart speaker. Alexa, play Manx Radio.
Text 166 177, email studio@manxradio.com or call 66 13 68.
Manx Radio. A&B Metals, A&B Metals. Gates and railings, balustrades, structural steel, it's our game. Come to the A&B Metals crew, there is nothing we can't do. A&B Metals know the rules, we've all been to metal school. All our teams are skilled to use all the metal working tools.
If it's made of metal, we can make it. Visit the island's premier steel suppliers and fabricators and see what we can do for you.
A&B Metals, A&B Metals, A&B Metals. Crossroad Dial of Man, putting carers first.
Crossroads have been providing services to local carers and people with care needs for over 30 years. As the leading provider of support for carers on the island, our services are all about improving the lives of carers and giving them a break from caring. Visit crossroadsiom.org for more information.
Crossroad Dial of Man, putting carers first.
When you need a fitting memorial or headstone for a loved one, contact Manx Memorials in Peel. This long-standing family-run Manx company offer a wide range of granite and marble headstones and memorials, along with an island-wide inscription and renovation service. Manx Memorials skilled professionals will take the time to help you choose a suitable memorial, and we're proud to say we'll beat other local quotes. Call 843 861 or email matthew@manxmemorials.co.uk.
Bran flakes, tick. Pizza, get stone baked, tick. Tomato soup, tick. Oh, and tuna, remember, must be drained, tick.
Now you can enjoy Sainsbury's famous quality and value all the way down your shopping list.
Tea bags, tick. Kitchen roll, ultra absorbent, tick.
The Buy Sainsbury's ranges are the store cupboard and everyday items you use daily and save on whenever you shop.
Big tick for that.
Buy Sainsbury's, only at ShopRite, proudly locally owned.
Conister Bank have been helping people for over 85 years, and we're here to help your business through this global pandemic. As a local bank, we can either stand by or stand up, and we choose to stand fast to our commitment to this island. If your business has been affected, we can help with our new working capital loan with repayment terms over 1 to 5 years. For the first 12 months, you will only repay interest to allow your business time to recover. Call 694 694 and let Conister Bank help you. Terms and conditions apply.
Cupid qplus.co.il.
For your new bathroom, visit Qplus, the most extensive bathroom showroom on the island. With over 50 stunning displays from leading brands, including hundreds of bathroom fittings, tiles and flooring. Qplus provide free design and 4D virtual display, so you can really see how your new bespoke bathroom will look. Visit Snugborough Trading Estate or see online. Qplus. You imagine, we design.
qplus.co.il.
As the summer holidays continue this weekend, the nation's station once again becomes the Staycation Station. We're giving you the chance to win a 3-night stay in the beautiful Milltown apartments. The prize includes on-site parking, internet access and a delicious afternoon tea. To be in with the chance of winning, just listen out all day Saturday and Sunday to play our winning weekend wordplay. Get your name in the draw and we'll announce the winner on Monday morning's breakfast show at 10 to 9. So for your chance to head to Milltown, join us right across the weekend here on Manx Radio, the Staycation Station.
The Mannin Line with Andy Wint. Furnished by Magic Carpets.
With David Ashford through till 1 today. You can text, you can email, and you can get in touch as well. Health and Social Care Minister, are there going to be enough flu jabs available? And when will they be here, says Anne?
Right, so we know that the companies that are producing them worldwide have been ramping up production, unsurprisingly, this year with everything that's been going on. We've seen nothing to indicate there is going to be any shortage. In fact, if anything, there will be more available because we are now advising that everyone in the vulnerable category should get their flu jab this year. But we're not expecting any shortages at this moment in time, and they should be available on Ireland very, very shortly for people to start booking the appointments to be able to take them.
It's a personal question, Minister, and it's from Pete as well. He said, you just gave out your phone number on the air. Why do you give out your personal phone number?
It's the best way. It's one of the best ways of people getting hold of me. I've always, even when I was a Douglas councillor, my personal number is out there. If people go onto the Tynwald website, or in fact even onto the government website, that's the number that's displayed, is my personal phone number. It's just the way I've always operated as a politician.
And you don't mind people calling you?
I don't. They've got to try and get hold of me sometimes. They'll get the answer phone quite a bit of the time. But if they leave a message on the answer phone, I always try to get back to people as quickly as I can. I find it's one of the most efficient ways to contact me. So I've got no problem. My phone number is probably one of the most public ones out there.
And that's one of the things about politics on the Isle of Man. Everybody's phone number's available. Everyone's in the book. Everyone, it's on websites. And do you think that's an important part of Manx politics?
I think it's a very important part. It's one of the things I like about Manx politics. The people feel they can stop you in Tesco, they can stop you in the street and talk about their problems and actually get hold of them. Because let's be honest, in a lot of large jurisdictions, you'd never get hold of the Secretary of State for Health, for instance. You'd deal with his team or even, an area of the department. And I think it is an important and unique thing that the Isle of Man has, that people are able to actually get in touch with ministers, give their thoughts and try and seek help directly.
Because there's often that walk from Tynwald down towards Athol Street. You'll often see ministers being buttonholed by members of the public. Very often. I've seen you being buttonholed by people.
Well, I actually enjoy it. I think it's important. If you're coming into politics, you're there to represent the people. You're there to involve yourself with the people. That's the way I've always viewed it. If you don't like being stopped and chatted to by people, then to be frank, you're in the wrong career if you're in politics.
What resources were allocated to health and social care in the Treasury Minister's budget update to deal with the second wave?
So at the moment there's no direct allocation, but what Treasury has been doing is they've been running contingency funding. So the contingency funding remains in place. So all the things like, for instance, PPE that we've been having to source around the world, that has all not been paid out of the direct budget from DHSC. It's been paid out of Treasury contingency, and that contingency is still there to meet it. Treasury colleagues, I've got to say, publicly have been very, very supportive, and I'd like to thank them for that, because it has cost money to do this, and Treasury has not. I can't fault them in the way they've responded to DHSC's requirements.
We're streaming live on Facebook and on Manx Radio's YouTube channel as well. Of course, you can like us on Facebook, follow Manx Radio on Twitter, and subscribe to the YouTube channel. Have you completed the 5,000 antibody tests, and what did the department learn?
So the first set of antibody tests have now been completed. We did publish an interim report which people can find online, when we reached around about the 3,900 level of the tests. And then once we do the next 5,000, we'll complete a full report. One of the things we've learned is that it's tying in with a lot of the studies around the world, that antibodies themselves are only sticking around in mild cases for around about 3 months, and then they're either dissipating or disappearing completely. We also learned that in terms of people who've been in close contact with cases, so in other words living in houses together, that in 86% of cases they didn't catch COVID-19, and in another 8% they were cases in their own right. So we know that in terms of close contact prevalence, people self-isolating at home is not the great risk it potentially was thought to be at the start of the pandemic.
Is there a rhyme or reason to this? Or is this new methodology, or is this new, the way that the disease is going, does it follow a prescribed path?
I think that, I think it's all still up in the air. It's a brand new virus, so we're learning things every day. I mean, I need to emphasise that the findings from the initial antibody study is an interim report, and I need to badge it up saying that may all change on its head when we do the next 5,000. But there's some interesting stuff coming out of there, and we're seeing this from studies around the world. So, for instance, one I always quote, Andy, is at the start of the pandemic, everyone said children were going to be super spreaders. And then now we know as time has moved on, actually children are least likely to spread the virus.
Okay, let's go to line. We have Gareth with us. Hello, Gareth.
Hello.
You're live with David Ashford.
Hi, Gareth.
Hi, Mr. Ashford. Hi. I'd just like to elaborate on Scott's question, just a few previous questions ago there. I'd just like to add to it that the fact that I am the colleague who he was referring to, that if we do have to take unpaid leave, or any leave in fact, that it would have to be covered by more than likely a seafarer from the UK or possibly further afield. And I just believe that this is bringing completely unnecessary and avoidable risk to the island. When we are completely, we're available, fit, healthy to work. I was just wondering what your thoughts were on that.
Yeah, I mean, it is something that is being looked at. As I said, I mean, Scott emailed me a while ago about this, and I know it's been referred into Cabinet Office to look at. Unfortunately, like I say, the way the law is now, the only way a key worker exemption can be granted is for actual physical work purposes if the travel has been related to work. And unfortunately, in cases where the travel isn't related to work, then the key worker exemption doesn't apply.
And Scott's in a very unfortunate position.
He is indeed, as it currently stands.
All right. Well, we'll find out how that pans out in the future. I want to go to Malcolm now. Malcolm, you're live with David Ashford. Malcolm is with us. Yes. Hello, Malcolm.
Yes. Hello, Andy. Hello, Minister.
Hello, Malcolm.
I'd just like to just put a question about the reading in the Examiner yesterday, the lady that returned to the island having been banned from returning to the island for 5 years. Not a Manx lady. How she escaped the formality of filling the forms in and so forth, how she escaped those, or did she lie, or was it fraudulent that she had actually filled them in incorrectly? How she got away with it? First of all, she was banned from coming back to the island for 5 years. That was 3 years ago. And then she actually came here against all the rules.
Well, the first thing I need to say is I can't discuss absolutely the details of individual cases, particularly ones that are likely to lead to legal action. But what I can say is obviously she didn't get away with it. She has been caught. One of the issues is obviously there has to be the main check is people coming actually physically into the island and being stopped at the point of entry. We can put processes and procedures in place, but at the UK end, obviously, how they run there, we have no officers and no officials there to be able to monitor that. But certainly at the Isle of Man end, we do have border control, and obviously that was where it was picked up. So I can't go into the details too much of the individual case, but actually, if anything, it does show that the procedures ultimately work, and that she was picked up, that she tried to breach the rules.
Okay, thank you, Mike. Malcolm, I want to go to, we've got Chris. Hello, Chris. You're live with David Ashford.
Hello, Mr. Ashford.
Hi, Chris.
I think that the boat should be called David Ashford in recognition of your efforts and keeping the nation informed. But my question is, of the 5,000 antibody tests, what is the result so far?
So the results so far from the tests, and I do have to badge this up that it's a very, very interim report at the moment. There'll be a fuller report once the 10,000 is completed. But what we are seeing is roughly around about 2% prevalence around the population. So that there was probably, we estimate off that, although I really, really need to badge this up as it being an interim report, about 1,260 cases if you include asymptomatic, if you calculate that up. The other thing that we saw, as I just mentioned before, was about close contacts in houses, where 86% of close contacts tested had not had COVID-19. But what we're also finding, which is in line with studies in Italy and further afield in Asia as well, is the antibodies from COVID-19 only remain at a high level for about 3 months and then either dissipate or disappear completely in people that have had it in mild cases. Now, that's not quite necessarily as concerning as it may sound, because some studies around the world have shown that actually those people are still having what's termed a T-cell response, which is in relation to other cells that fight off the virus should you try get it. But it does build a picture that we can't say with any certainty that people are immune from getting COVID-19 for a second time.
Yeah, well, thank you very much.
All right, thanks for calling us today. Let's come on to the Sir Jonathan Michael report now, the future of the health service. Where are we with Manx Care?
So in terms of Manx Care, the legislation is now in the branches. We're up to second reading stage, and when Keys returns in October, I'll be bringing forward the clauses stage. We're ready to get the Manx Care Bill to Royal Assent, hopefully for February, ready for Manx Care to go live in April.
Where does this leave Catherine Magson?
So Catherine Magson remains CEO of the department. She's on a 2-year limited term contract at the moment. So that would expire, I think it's January 22, if I remember rightly. But basically she remains CEO of the department. The department will still exist and it will still require a chief executive officer.
How much difference will there be in the new health and social care department than the one now? What's the
So the real big difference is the separation of policy and delivery. So delivery will be the forte of Manx Care. They will be responsible for concentrating on making sure that the services that are mandated are delivered, and the mandated services will be decided by the department. So myself as Minister and the department will be more focused on the policy, more focused on what we need to deliver, and Manx Care will actually be doing the how it's delivered.
And what will that do that wasn't done before?
Well, I think what it will stop the confusion, because there is overlap at the moment between policy and delivery. And I think sometimes that, to being blunt, slows things down. And also, I think sometimes it doesn't give the attention to the delivery that's required on the ground. So I think that Manx Care, which is a purely focused delivery body, will actually be able to give it the attention it deserves for us to build a health service that people quite rightly deserve.
David Ashford, MHK, the Department for Health and Social Care Minister, is with us today. In, I think it was July 2020, the DHSC report said 9 out of 10 medical speciality doctors' posts in medicine were vacant. How is that situation now?
So we have started recruiting to quite a few of the specialities now. We have had some new appointments made, but to be frank, it is still a concern. As I mentioned at the start of the show, Andy, speciality doctors, there's huge demand, not just in the UK and Europe, but around the world for these positions. So we are in a global marketplace. But one of the things that will help is we now have access to advertise on NHS jobs. Previously, because we are a completely independent NHS, we haven't had access to that, but the UK has now granted us access.
And what difference will that make? Will
so
that, a wider pool?
NHS Jobs is really the go-to site for people who are looking at job vacancies anywhere within the UK NHS. Previously, we've had to do our own advertising campaigns, which we will continue to do, because I think we've got a great story around health and social care to market here in the Island, further afield. But we will now have access to that go-to site as well.
David, you're live with David Ashford.
Morning, Minister.
Hello, David.
I've just returned from Aintree. I went over Thursday, and I'm self-isolating at the moment. I went over there for an injection for wet macular deterioration. And I was informed, it was quite a traumatic day out, obviously, and I was informed that there's a team comes over of a Friday to do injections at Nobles Hospital. I don't know whether that's true or not, but I have underlying health problems. I'm 80 years old, and I thought I'd have a quick word with you.
Yeah, there was pre-COVID. I must be honest, I'm not sure if they have restarted up the Fridays yet, but there was limited capacity where a team came over on the Friday to do it, but it is exceptionally limited, the capacity. To give you a bit of the background history, we tried to go out for tender for a completely on-island service. About must be, I lose track of time now, but I think it must be about
2015, wasn't it?
No, this was during my time as Minister, so it'd be about the last 18 months. Where we tried to get the service completely on Ireland. Unfortunately, that tender process failed, and so we have been stuck with the situation that was there before, where most people still have to travel off. But again, if you're willing to give me your details, I'm willing to look at it, because one of the things we do try to prioritise is in relation to I don't want to say you're going to take great offence if I say the more elderly population, so I'll try and avoid that. But for those in the older age range to try and be done on Ireland where possible. So again, if you drop me a line with your details, I'm more than happy to look at it.
Okay.
Thank you.
All right. Thanks for being with us today, David. The treatment of cancer on the Isle of Man took a pause when COVID happened, and of course cardiothoracic services paused as well. When will they return to anything like normal?
So they are slowly returning to normal in terms of clinics being reset up and starting again, although in relation to the bowel cancer screening, that has been delayed because of work that still needs to go on to get that restarted. But the big issue is obviously during the pause, the backlog and lists were building up, particularly in the breast cancer area, which is a great concern to me, and we are already looking at ways to try and bring that list down, because that one is particularly, for me, quite concerning at the moment. But COVID really did cause problems for our cancer treatments. We didn't obviously have the input into the UK because they shut services down as well. And that did lead to people having to wait for treatment, because one of the things we saw coming out of Italy, and also further afield than Italy as well, was the fact that people with cancer, if they caught COVID-19, their mortality rate was 5 times higher than normal. So it was a real risk for cancer patients, and unfortunately, like a lot of countries, we had to take the balance of risk that actually COVID-19 was probably more instantly deadly to them than the actual cancer they were suffering from.
17 minutes to 1. The Mannin line rolls on till 1 today with David Ashford, MHK.
Listen to us on your smart speaker. Alexa, play Manx Radio.
Text 166 177, email studio@manxradio.com, or call 66 1368.
Manx Radio. Just hop on board with Tours Isle of Man for the best holiday you could ever plan.
Tours Isle of Man have launched our 2021 schedule of fabulous coach holidays with trips to England, Scotland and Wales. You'll be picked up and safely transported by coach to your perfect destination. Hotels are always chosen for their high standards, and excursions are included. View all our schedules online.
Visit tours.co.im.
Pacesetter, the longest established bathroom showroom on the island, for expert advice and bathroom solutions that work, with new innovations and designs, including the latest walk-in showers. From practical, accessible bathrooms for an aging generation to the ultimate in luxury, domestic or commercial. Visit Pacesetter Tile and Bathroom Showroom, Harris Terrace, Douglas, or search online for Pacesetter Douglas.
Whatever your profession, achieve success with ambitions. Trust ambitions.
So what direction are you going to take after uni? Your prospects are exciting and daunting at the same time.
So why not give us a call at Ambitions Employment Agency? We can show you some great opportunities on the island. Come and see us for a free, no-obligation chat.
Whatever your profession, call 614-841.
They got your whole house in their hands.
When you need scaffolding,
DPM.
On time and on budget,
DPM.
We'll beat any quote.
DPM. We do it all at DPM.
DPM promise to beat any like-for-like scaffolding quote by 10%. So when you need scaffolding, call the friendly, experienced DPM scaffolding team on 61-2000. T's and C's apply.
We do it all at DPM.
Chase Wealth are here to help you. Whether you're looking for advice on savings, investments or pensions, we're happy to help and provide guidance. We also specialise in lifestyle planning to help you really understand how you can use your finances now and in the future. Call 640-350 or email advice@chasewealth.in. No investments are risk-free and they could go down as well as up. Chase Financial Services, trading as Chase Wealth Solutions, is regulated by the Isle of Man Financial Services Authority.
If a holiday is no longer on the cards for you this year, perhaps it's time to treat yourself another way. Redecorate your home with help from Swales Flooring in Laxey. Stocking trusted brands including Amtico and Cars Flooring, designed to last and impress. Swales are also the sole island distributor for Farrow and Ball, the traditional wallpaper and paint specialists. And if your home is already blessed with original wood flooring, talk to us about how we can restore them to their former glory. Visit the Swales showroom or call 861-542.
The Mannin Line with Andy Wint. Furnished by Magic Carpets.
And David Ashford, MHK, the Minister for Health and Social Care, is with us today. Howard Quayle sorry, it's not the Howard Quayle, is it? It's that Howard Quayle, is that right?
It is another one. Yeah, we're all over the place, a bit like a bad cold. No, there's no questions for the Minister. Good afternoon, Minister.
Good afternoon, Howard.
No, it's for all the unpleasantness and hassle and hackle we've had over the last 3 or 4 months. Can I don't know, I'm taking this as a presumption. I would like to make a public thank you to you and your colleagues, because you've been like a mother hen looking after her chicks, and you've kept us all pretty well safe and sound. It's been a horrendous task, and it's one that in a few months' time, hopefully, it'll disappear, and this will be gone, and it'll disappear into the ether. And I'd like to just say now, on behalf of the public, I hope a great big thank you, and congratulations on your ability to steer us through this COVID.
Well, thank you very much, Howard. I mean, it's been a difficult time for a lot of people, but it's the public as well that have managed to get us to where we are. They've listened to the messages that have been out there. They've done as we asked, and so I think it's the community spirit of the island that deserves the big thank you, because I think that's what's got us where we are. But no, thank you very much.
All right, thanks, Howard. Back in March, did you have any idea how this thing was going to pan out?
We certainly didn't think we'd be in the position we're in now, Andy, to be perfectly honest. If you'd told me back then that we'd be in the position where we are now with 70-odd days of no cases, I would have told you would be joking, that we'd probably still be having community transmission. But we could see what was coming, and I think that helped us, because we could see what was sweeping across Asia. We could see it starting to come into Europe, and that brought us time to plan. I know in the early days it might not have seemed like we did have a plan, but we did. We always had a plan as to what we would do when we got the first identified case on Ireland, what we would do when we had the first community transmission case, and there was always a rough plan as to how we would move from there.
You kept talking about taking clinical advice. Who gave you the clinical advice?
So the clinical advice is delivered by the clinical leadership team. So that is chaired by the Director of Public Health. It involves the medical director. And I apologise because I always end up missing people out now. There's, I think, 4 GP representatives. It's all the clinical leads. There's a mental health representative on there as well, the clinical psychologist. So there's a wide range across social
they get
care.
all the information, filter it, come to a conclusion and present you with that.
Yeah, I mean, obviously it's a recommendation. It's ultimately up to council and ministers to make the decision. It's the old phrase, the advisors advise, the politicians decide. But, the clinical advice, I think, has been very sound throughout this.
Fenella, you're live with David Ashford.
Oh, hello.
I'm just wondering, well, my husband was wondering actually, has anybody with Parkinson's in the Isle of Man had the COVID-19?
As far as I'm aware, we haven't broken it down that much by antibody testing, and we don't break down the individual cases that much because it would actually identify people. But as far as I'm aware, I'm not aware of anyone having a particular individual medical condition with it.
Yeah, because we don't think there is, because the secretary of our society has rung round everybody to find out how they are, if they're all right. And they've all been all right.
Yeah, I mean, I know a lot of the Parkinson's sufferers that I know personally. That a lot of them went to Shield basically. So as soon as they actually heard about the COVID-19 and the issues on Ireland, even if they weren't in receipt of a shielding letter, they actually shielded themselves.
Yes,
so
well,
with a
Rob,
lot of the medical conditions,
Rob didn't get one, but I got one.
Yeah,
not for him, for me.
Yeah,
but I haven't got Parkinson's, but I have had I've had one or two operations, but not that recently. But I think they did say it was due to my medical notes or something.
Yeah.
Interesting. Another point about the flu jabs. Thank you, Fenella, by the way. How are we going to distinguish between the normal snotty noses during the autumn and winter and the flu and COVID?
Right, well, the PCR testing, we've stuck with the gold standard test, which is PCR. PCR can tell the difference because what it looks for is the RNA of the virus.
PCR means?
So it is basically the swab test, to put it into layman's terms. Sorry, I slipped into health talk there,
yes.
Andy. But basically it looks for what's termed the RNA of the virus. Each virus has a distinct RNA, and so it can distinguish. So, for instance, if someone presented up at the grandstand with flu symptoms, was tested, we'd be able to come back and say it's not COVID-19.
Because some people will have the fear of God put into them if they get something like a flu. So it's as soon as you get something like flu symptoms, what do you do?
So they contact 111 and they will then arrange to be tested. One of the things that we've changed, of course, recently is if you've been on Ireland for 14 days and you're tested and the test result comes back negative, then you don't have to self-isolate. So that means even in the worst case scenario, people who are presenting with flu symptoms, as long as they haven't had travel in the last 14 days, will only probably have to self-isolate for 24 hours because the test result will be back. And to be perfectly frank, if it's full-blown flu, you're not going to feel like doing much for those 24 hours.
Fiona, you're live with David Ashford.
Oh, hello. Good morning, Mr. Ashford.
Good morning.
Good morning. Yes, I'm in a situation where my father, who's 100, is really dying, and I have family across who may well want to come and see him and all attend the funeral. And the complication, of course, of self-isolation would mean 2 weeks self-isolating somewhere. I'm wondering if there are extenuating circumstances, but also whether with the COVID test, and I understand they've got the quick return one up at Nobles, I'm wondering if there's a way to shorten that 2 weeks so they're not isolated on their own for that period of time.
So in terms of that, the rapid PCR testing, unfortunately, is exceptionally limited because of demand around the world. I think it's 12 a week we have access to. So it is really limited to extreme circumstances that they're used in. In relation to funeral pathways and so on, well, firstly, can I say I'm sorry that you find yourself in the situation that you do. It's a dreadful time for a lot of families, but there is a compassionate ground where, say, for instance, if someone needed to go for a funeral, they could travel into the island, self-isolate, but then attend the funeral. They would have to social distance at the funeral, unfortunately, and they're not allowed to go to family events afterwards. They're only allowed to attend the service, but there is that pathway available. And there is also for people to come in and visit sick and dying relatives as well, where with the use of PPE, they can actually visit them while they're in the isolation period, but it is unfortunately a strict 14 days for anyone coming in at the current time.
Okay. All right. Thanks, Fiona. Thanks for making us aware of that. Final question from Margaret. Could you please ask David, when is it phototherapy or photon therapy will resume on the island following the retirement of the previous technician? We've got a minute.
Yeah, so phototherapy, to be frank, I think it's going to be a while because we are going to have to employ a new technician, and it's not, it is a specialist area. It's not something just anyone can undertake. So I'll have to be perfectly honest and say it could be a while yet.
Okay, and another question. Oh, no, sorry, you did that very quickly. Another one is, what are you doing with your 8 weeks off during the summer?
Well, as you can tell, I'm here in the studio. I'm going to be doing a lot of constituency work and a lot of work within the Department of Health and Social Care.
And will you be going to Guernsey?
No, I won't. It's all booked up.
Any of your colleagues going to Guernsey at all?
I think the Chief Minister is.
All right, well, thanks for being with us today. David Ashford, MHK, Health and Social Care Minister. And if you want to send any more messages, then, by the way, we're manninline@manxradio.com. Thanks to our studio producer today, Ben Hartley. Late lunch is on the road at the Cook Shack in Bride. I hope the weather's better in Bride than it is in Douglas. And the Mannin Line is back tomorrow live from 1 o'clock. We're open line tomorrow. Again, you can call the answer phone on 682-631 or email manninline@manxradio.com. This is Andy Wint. Have a nice day, and I'll be back tomorrow at midday.